First of all, I want to give my profound gratitude to the two higher powers, Jehovah, the Almighty God, and the Son Jesus Christ, who have made it possible for me to be in your presence today, and for the grace of strength and health for standing before you today. I stand upon all protocols. I want to first of all commend the beautiful girl child who had treated first just now, and thank God for the healing. The topic for today is centered around them. But before I go into my topic, I quickly want to throw a little light. When my fellow sister was talking before now, she talked about a dramatic thing, or about a pregnancy that was not there. That maybe that was a magic. There's something in medicine called pseudosciences, and it mimics the typical pregnancy, and it could go for long. If the woman does not go, in fact, you can even do a pregnancy test and come back with a positive result while there is no actual fetus there. It has been found in 3 theories, especially in women who have been married for a long time, who have been anxious, who have been in anticipation for getting pregnancy. It has a way of releasing some hormones that are related to pregnancy hormones, and as such, women begin to have signs and symptoms of pregnancy. Best thing is when you have any challenge, in fact, at the onset of pregnancy, it's always good to follow up your pregnancy test with a scan result, which will show that there's a fetus or not. Back to my subject, cervical cancer and the girl child. Cervical cancer and the girl child. Once the name cancer is heard, it was a lot of panic or unpleasant sensation to humans, following the fact that no cure. And to some people, it's like a death sentence. But we are here today to throw light on this particular cancer. It's just one of the other cancers that can actually affect women. Cervical cancer is a major international health problem. It's a major international public health problem. It is the 3rd most common cancer in women worldwide, while it is the 2nd most prevalent cancer among women in developing countries, including Africa. Almost all cervical cancers, about 99% of them, are linked to infections from the human papillomavirus. We'll talk more on that later. While talking about the girl child, she's a biological female offspring from 0 age to about 18 years. The girl child. Now, the girl child, as weak or as tender as they may look, they are built with so much unique complexity to fit the functions or the characteristics which they will carry out in life. So weak they may look outwardly, they are very strong within. In fact, I used to have one of my consultants say that women say they are very strong. And pardon me to use this language, that they are stronger than men, that even for the pain that women go through, whether through menstruation or through childbearing, that when men are put with equal amount of such pain, they couldn't stand half the pain, or their pain threshold is not as high. So the girl child is a beautiful, complex being made or created by God. It is estimated in 2018 that about 570 women were diagnosed with cervical cancer, while about 311,000 women died from such cancer. It is painful to note that such deaths are avoidable. That is why we are here today, to let us know that knowledge is power. Because when you are aware, then you can also take charge of things that you can modify in your life. The prevalence of cervical cancer worldwide is estimated to be about 12%. More Africans than whites are affected, and this is basically due to differences in towards sexual practices and penetration of mass screening program, with highest incidence of these in population that have the highest background of prevalence of human papillomavirus infection compared with low screening rates. What we are just trying to say here is that cervical cancer, unfortunately, is said to be more in Africans. Why? This is because of a lot of our practices. In the Western world, there's a routine vaccination scheme for the girl child to prevent them from being exposed to the virus that actually causes this cancer, which we will see with time. The age group mostly affected by cervical cancers are frequently diagnosed in women between the ages of 35 and 44, with average age at diagnosis being 50 years. It is very rare in teenagers and young adults. Now, what is cervical cancer? I'll please want to direct our attention to the wall there. You see there's a diagram there showing the womb, the vagina, and the cervix. The cervix, cervical cancer is the cancer that affects the cervix. The cervix is like the mouth of the womb. From the vagina, you get to the cervix. It is the entrance into the womb. There's a small lid there that we call the cervix. So when the cancer affects that small lid, that is what is called cervical cancer. It is a malignant tumor deriving from the cells of the cervix. When these cells become abnormal and they grow out of proportion, it is said to have been infected with a cancer called cervical cancer. The cancer is slow growing but develops quite slowly. Its progression through precancerous changes called dysplasia provides opportunity for prevention, early detection, and treatment. That is, what I'm trying to say here is that cervical cancer is one of the cancers that gives you an opportunity to detect it earlier, because it takes a very long time to progress from the normal cells to a cancer cells through a process or a progression which we call dysplasia. That is, the normal cells, they first change into some abnormal cells. At this stage, it is not cancerous yet. But it gives you an insight that something is changing here, and in a couple of years, it could progress into a malignant or cancer cells. So this gives you for quick intervention and treatment. There are basically two types of cervical cancer. We have the squamous cell carcinomas and the adenocarcinomas. The third is a combination of the two. What causes cervical cancer? Research has shown that cervical cancer is primarily caused by persistent chronic infection of one of the high-risk human papillomavirus infection. Human papillomavirus is a DNA virus which affects the female gender. It could be in the male doing nothing. However, when the male infects the female with it could lead to cancers. We have over 40 types, over 100 documented types of this HPV or human papillomavirus, 40 of which are known to infect the anogenital tract. Between 12 and 14 are high-risk genotypes that can cause progression to cancer. However, the most implicated for cervical cancers are the human papillomavirus 16, 18, 31, 32, 35. Now, all these are just the different types of human papillomavirus. When you do the test, they will see the different types. This is because it is not all human papillomavirus that can cause cancers. There are some that can cause genital warts, there are some that can cause other ailments, even in males. But the ones that are implicated in cervical cancer, two in particular are type 16 and type 18. What are the risk factors for contracting this disease? There are many risk factors, just means that what are the things that increase infections in women currently. I also want to quickly note that most women, over 90% of women in their lifetime have been infected with this virus. However, there are some, your immunity, if you have high immunity, you fight it and you clear it off your system, while other women don't have this opportunity. Sexual history. Several factors related to your sexual history can increase the risk of cervical cancer. A woman who has a higher than average risk of developing cervical cancer. A woman has a higher risk of developing cervical cancer if one, she has multiple sexual partners, began having sexual relations before the age of 18, has a partner who has had several sexual contact with a woman with cervical cancer. And I'm having a report which is not here, also having a partner who has multiple sexual partners. Because yes, a woman may not have a multiple sexual partner on her own. But if a spouse has multiple sexual partners, she's as good as also having multiple sexual partners because she's exposed to all the risks involved as well. There's smoking, weakened immunity, giving birth at very early age, long-term use of contraceptive pills, having multiple full-term pregnancies, young age at full-term pregnancy, less than 20 years, a diet low in fruits and vegetables. It's been known that women who have had several pregnancies, especially when they are carried to full terms, they are also exposed or have a higher risk of developing cervical cancer. This is also because the longer you keep the pregnancies, and there are some hormones in pregnancies that can also weaken your immunity and also promote the viral replication. Then the risk factors that cannot be changed are one, the use of diethyltestosterone in mothers. This is like an hormone used in the 70s to prevent miscarriages. It's been found out that women who took this hormone, who were given this particular drug, when they give birth to daughters, those daughters have a higher risk of developing cervical cancer. You also have what's called chlamydia infection and family history. When it could run in the family, when a mother has been diagnosed in the past to have cervical cancer, a girl child, especially the first, is also exposed, but she has a higher risk of also having cervical cancer. The importance of this is for us to know that if we are at any time diagnosed of this disease, it's for us to look at for our girl child so that we can help them and prevent this on time. What are the clinical presentations? What are the things you see that will give you an insight that there's trouble somewhere? One is bleeding that occurs between regular menstrual period, intermenstrual bleeding. If you have a 28-day cycle menstruation, you menstruate on the 1st, for instance, and you're supposed to menstruate on the 8th. If on the 14th you are menstruating, then something is not right. Then you need to take action. That is what we call intermenstrual bleeding. Then bleeding after sexual intercourse, dowry or pelvic examination. You know, like I said, cervix is the entrance of the womb, situated in the vagina. So, if anything touches it, either by intercourse or by dowry, or when the doctor does an pelvic examination and there is bleed after such, there is problem and need to take a special look at that. Menstrual periods that last longer and are heavier than normal, bleeding after going through menopause, increased vaginal discharge that is not normal to the woman, pelvic pain, pain during sexual intercourse. These are some of the presenting features or a clinical presentation, you will see there are a lot of others depending on the stage of the disease. For instance, these are early signs. If the disease has progressed further, you could have waist pain, you could have severe waist pain, you could have other symptoms that are signs or symptoms of metastasis. That is, the disease has progressed to other organs in the body. You go to the chest, you may have persistent cough or bleed or hemoptysis when you cough out blood and all that. Those are towards the end. How do you now diagnose it? This is basically meant for the health personnel. As part of a pelvic examination, they could do what we call visual inspection with acetic acid. They look at the cervix, they put acetic acid there. There are changes that will occur, that we will see and know that this is abnormal, and we take action. In fact, the current practice now is, as soon as you do an examination, be ready to intervene, not inspect and do all that and allow the person to go. You have to do something for our knowledge, so that if we go for an examination and this is done and you are asked to wait behind for another intervention, you would not be surprised. Then there is what we call pap test. Pap test, in fact, is propagated currently. Thankfully, it's a little expensive, but it's a routine test that every girl child or every female should go through. When you go to the hospital, they'll take a sample from the cervix and send you for histology, and they'll look at the cells if they are changing or they are still normal. Then we also have the HPV DNA test to actually check if this woman has an infection with the human papilloma virus that causes that cervical cancer. And then we take a biopsy from the cervix and send to the lab. This could also be diagnostic and also therapeutic. And we also have the serum tumor markers, colposcopy. They use a light to look at, pass a light through the cervix and look at the cells and look at changes that are occurring there. And you can also have to do a CT scan or a pelvic scan. All these will give an insight of what is happening in the cervix. Then let's quickly go to treatment. The treatment depends on the stage at which the cancer is diagnosed. Basically, we have surgery, we have radiotherapy, we have chemotherapy, and some other interventions. Like research has shown that there's what they call the flavonoids. They are chemical compounds. These are found in fruits and in vegetables. They are known to give protection against cervical cancers. Foods that are rich in these are apples, black beans, broccoli, Brussels, sprouts, cabbage, garlic, onions, and spinach. We also have folate, which is water-soluble vitamin that reduces the risk of developing cervical cancers. Food rich in folate include avocados, beets, lentils, oranges, and strawberries. Then we also have carotenoids, a source of vitamin A, which also is helpful in preventing cervical cancer risk. Food that are rich in vitamin A are carrots, sweet potato, and pumpkins. Then we go to prevention, which for me is the highlight for today, because we are talking about cervical cancer and the girl child. The high point is to prevent the beautiful girl child from even contracting this disease. Today we have seen a lovely girl come out here to display her talents. The future is so bright for her. The sky, they will say, is a stepping stone. One can but imagine, not unto us, but a little girl with bright future being hampered by something called cervical cancer that could have been avoided, prevented, if there's a timely intervention. So we'll talk about primary prevention. Primary prevention, the target is for the girl child from ages 9 to 14 years. At this point, the target is that at this point, they have not been sexually active. I am sorry to say that today we are living, it's difficult to put your hand on your chest that every girl within this age range have not been sexually active. It's a painful reality. But however, that is the target. It is expected that at this age, the girl has not been sexually active, and as such, she has not been exposed to that virus that causes the disease. So that is the target. And that is why we are here today. And looking at my population, I would have thought that we have a lot of beautiful girl children, filling up this space, so that as we discuss this, they will also go home with that knowledge and be empowered. This is because, let's not take them for granted. They go to school, they know a lot of things. Social media has made a lot of things open to people. So once you teach them, they go back, they do their own research. And even if you parents are slowing down, they will remind you, mommy, there's something like this. I'm meant to do this at this age. I'm meant to do that at this age. However, since I want to give kudos to those who brought their girl children, and I also want to encourage us that if we have such things next time, let's come along with our girl children, and they will also learn. At age 19, the target is to vaccinate every girl child from the age of 9 to 14. The vaccine is available. It's expensive, but it is worth the money. They said prevention is better than cure. If you think prevention is expensive, then you try treatment. You will see that the 15,000, between 10 and 15,000 rands that you use to vaccinate your girl child is not worth the money. It's not worth the money for treatment. And it takes about 2 doses for the girls within this age. The first dose and the second dose. While for higher ages, we have 3 doses, and including women, we have 3 doses. Then, another stage is the girl child and boys as appropriate. What we do for prevention is health information and warning about the use of tobacco. Because tobacco has also been known to be implicated in many of the cancers we see today. So we do a lot of health information, educating the girl child, teaching your girl child to keep herself, to know that outside the laws of God, talking or saying that this is a sin, there's also health value that will help them if they keep themselves. If we remember one of the risk factors, multiple sexual partners and exposure to sexual activities at an early age, a risk factor for developing this. So part of the health education is to tell them this. Tell them the truth. You shouldn't be ashamed. When you get your girl child, tell the girl child, speak the language you understand. If you don't understand, you speak Yoruba, speak anything, and tell her, say, zero, the disease when we don't like today. They say, if girl, quick start to sleep with man. Some of us, we are ashamed to use the word. But it's the truth. And they know it all. They are just there thinking they don't know anything. They know. Use the word for them. And tell them that if you quick start to sleep with man, something when they call cervical cancer day, he go quick cash you for that place when woman take the born. If you can't explain anything, just tell her like this and keep hammering it from fear so you abide. Male circumcision. Circumcised males have lesser risk of having HPV infection. Sister, sometimes when I look, I'll say, God is awesome. He knows it all. You see, the things He has done and prepared for man beforehand, they are all for our good as it is stated. That time He was telling Abraham to circumcise his son and put in the law of circumcision. Who would have known that there are other things that He was trying to prevent us from? So males that are circumcised, they have a lesser risk of having that HPV virus. And if they don't have it, they also cannot spread it to the opposite sex. Then talking of secondary prevention, we'll shift now to women ages 30 and above. Also involve educating them and telling them these things exist. There are a lot of women even at age 30 who have not done a pap smear in their lives. And I'm sure we are still many in these settings. This is to tell us that every woman at 30 should at least have done a pap smear. This pap smear is to look at the cells in your cervix and they'll tell you they are normal. Come back in 2 years or in 3 years for a repeat test. And if you are above 40, they can tell you to come every year. And should they see something that is abnormal and not very clear cut, they will tell you to repeat this test in 6 months. A pap smear is between 5,000 and 10,000, depending on where you are doing it. But if you go to the government setting, you get it for as cheap as 3,000. The point of care rapid HPV testing for high-risk HPV types. Then there are some people, if they've done a test and they see that you have human papilloma virus, they will go ahead to do further investigations and immediate treatment, and even on site at the point. The medical women of Nigeria, especially those of Delta Zoo, they've been advocating this, going around different churches, different settings, and doing this pap test and visual inspection of contraceptive acid and treat it on the spot. They are championing their cause. I want to pay our indulgence to key in into such if at any time you see this. I want to also at this point encourage us as parents that parenting should be intentional, focused, and purposeful. If God has blessed you with a girl child into this world, it is our responsibility to also see that we give them all it takes to be their best in life. The joy of every woman is to look back when you are old and see an healthy child, an healthy daughter stepping into your shoes and doing well. If the girl child is infected with cervical cancer, peradventure was not diagnosed on time, I can assure you that it will not bring any joy to you as a mother. In fact, there will be times you will look back at yourself and blame yourself that you didn't do well because you didn't give your child all that she needs to grow up to be the best she can be. So it is on us as mothers to go back home, take a look at our children, take a look at your beautiful girl child, and imagine her in the next 10 years, in the next 20 years, in the next 30 years, when you are now a grandmother, and suddenly, God forbid, a sad news comes that this happens. Will the 15,000 of so many years back have done any difference? The answer is yes. For 2 doses, it's 30,000. For 3 doses, 45,000. This is the extreme I'm calling. It could be cheaper. So let's plan. As the girl child is growing, she's 5 years, she's 7 years, we keep educating initially. Don't go close to any man, because when you are 9 years, I want to give you this vaccine. And if you are exposed, they will know. So once she knows this, she will be careful. So as mothers, let us take charge of this and champion the cause of preventing cervical cancer in Nigeria. The goal is that by 2030 to 2050, there will be no disease called cervical cancer. This is because the disease is slow growing. If I do a test today and there is a change in the cells of the cervix, it may take you another 5 to 10 years for it to change to malignant cells. Why not key into this privilege and vaccinate your child and do pap smear and probably treatment if need be. In conclusion, I say cervical cancer is one of the successfully treatable forms of cancer when detected early and effectively managed. By its slow progression through precancerous stage, it gives room for prompt, adequate, and successful intervention. With comprehensive approach to prevention, screening, and treatment, cervical cancer can be eliminated as a public health problem within generation of every female or girl child. And if every generation of female or girl child is given the opportunity to adhere to current HPV vaccination programs that is ongoing, the total number of female deaths from cervical cancer globally will drop by hundreds of thousands each year. Above all, is to be prayerful while we look to God for good health and cure. Thank you for listening.
Applause, please. That was Dr. Sister Awa giving it to us the way she knows how to. Thank you very much.